Hey, welcome back to Ultra Life Today. I am Josh Bellew.
I'm Adam Payne.
We are, Adam, by the way, the makers of the products that you can feel. You know, forever and ever, people went along saying, I know curcumin is good for me, but ho-hum.
Well, it's one of those faith nutritional supplements. I believe it's supposed to be good for me, and therefore I'm going to take it even though I'm not feeling anything.
Yeah,
but behold, UltraCur.
You and your colleagues over at the University of Oklahoma Health Sciences, Oklahoma Medical Research Foundation, you solved the conundrum, and you've made curcumin, molecular curcumin, that can literally migrate into the bloodstream at exponential levels. And it does different things in the body because it now can achieve what curcumin was supposed to.
Well, there's so many. It's what we call a pleiotropic compound because it has so many different places that it attaches to.
I call it magic bullet.
Magic bullet.
What I call it. That's the medical term. And so we're going to dial back in here with Dr. John Spence, Vidalia, Georgia, Regenerative Medicine Associates. And I was running down a path before the break, but I think we're going to put the brakes on that a little bit and compare hyperbaric oxygen to ozone because Dr. Spence has a wound care facility where they use a lot of hyperbaric, but at Regenerative Medicine Associates, they primarily use ozone. So what's the difference? Why do one over the other? And what's more convenient? And what's got better outcomes?
Well, as far as the outcomes go, that would be hard to pick because it's usually a different flavor of patient for each one.
It's a different modality.
Okay.
Yeah, the ozone we generally use, I was going to say just for optimization, but we use it, and I meant to mention that earlier, that we use it a lot for acute illnesses. I had a patient last week who called and said she had family in for Thanksgiving, and the next day she had a fever. She felt horrible.
Oh, wow.
And wanted to come in and do ozone. I called her the day after her ozone treatment. She said, I am 50% better. I feel so much better. And I talked to her yesterday, and she's like, I'm back to normal.
That's astounding.
And
wow.
That is a wonderful thing. Another interesting one, I had a patient who had a cold sore, and she had to go somewhere. It was a wedding or something, but had like a bad cold sore on her lip that popped up, and she came in and got ozone, and it was gone the next day. Those viruses do not like ozone. Yeah, it's
interesting.
It is neat stuff.
So you had mentioned earlier, and I want to just dovetail back there. When you mentioned long haul COVID, a lot of people. I have friends, Dr. Spence, that developed COVID a year and a half ago that are still having lingering brain fog, fatigue, unusual muscle aches in their body that won't seem to go away, almost like when you overwork a muscle and it just stays tight and you all of a sudden you've got a loss of range of motion. Have you seen all that? You mentioned ozone as something that was a potential to facilitate helping someone get over long-haul COVID. Explain that.
It's the best thing I have seen for long-haul COVID. Usually we would do it
interesting
with supplements, but it's been pretty amazing. I had some patients come down. Atlanta's about 2.5 hours away. There was an executive who called me, and I knew him because I used to live in Atlanta, and he said, he's in all these high-speed board meetings, and he said, I cannot even come up with words. I mean, I'll be sitting there, and I just feel dumb.
I know how that feels. I've experienced that in my last bout of COVID. It was like I would hit a wall, and my brain would shut down completely. Yeah. It's terrible. It's a terrible feeling.
So what was his experience, Tom?
Super excited was his experience. He stopped to text me about halfway back to Atlanta, and he was like, I feel wonderful. And that was
really?
That was 6 months ago.
So go into again to the protocol, what you do. So are you taking a unit of blood out of his body and ozonating it?
Yep, it's a little. It's almost an egg shaped, like an elongated egg shaped container that's airtight, and it hooks into a machine that will literally draw the blood out. It will hold it there, and then it will dump in the pressurized ozone at whatever concentration you've set the machine, and then a circulator is circulating the egg to kind of stir things up, and then it will deliver it right back. And
so it's kind of it's an enclosed process and sterile and
absolutely.
I guess it's safe. I hope it's safe.
Now, now I heard you just briefly, as an aside, when you were talking about ozone for long haul COVID, you also mentioned certain supplements. If somebody's coming to Dr. Spence with long haul COVID, what is your absolute, this is my protocol, this is my cocktail, along with ozone, I'm going to do these things?
That might be a little unfair to ask him to share his secret sauce, Josh.
No.
I have a feeling this guy likes to see people be helped and get well.
Okay. All right. Let's see.
There are some basics. Your curcumin would be in there. You also want CoQ10, a pretty high dose of CoQ10 a couple times a day. Quercetin is very helpful. I'll tell you something that is amazing. Is methylene blue. I don't know, you've probably heard of
methylene blue. I've heard a lot about methylene.
I heard some people mentioning that, and I just never went down.
Dr. Weber has gotten into methylene blue.
Okay.
And,
if I'm not mistaken,
familiar with the
Go ahead.
Go ahead.
Which Dr. Weber?
Dr. Weber, the Webers from Germany, from Weber Medical. They make the photodynamic lasers.
Yeah, no, I was wearing his laser on my wrist about an hour ago. Yeah,
you're kidding.
That Dr. Weber with the probe stuck up my nose. Weber. There we go.
Yeah. So you're familiar with his stuff. Yeah.
That goes hand in hand with methylene blue. Yeah,
interesting. He actually distributes a lot of our products over in Europe because of they use our curcumin for photodynamic therapy in all over the European marketplace. Yeah.
Just so if you weren't aware of this, if Dr. Thompson had it shared with you, or maybe Dr. Ellenberg there in Alaska, I saw Dr. Ellenberg on stage at the International Society for Laser Applications conference, and he was, doing some treatments. And he said, now in our facility, he said, we tell all of our patients, if they're on the original UltraCur, we'll have them take a couple of capsules about 30 minutes prior to their appointment time with us. And if they're doing the Pro, if he's got them on the higher dose of the clinical version of the curcumin, the Pro, he says we'll have them take it about 40 to 45 minutes, and it absolutely enhances the effect of the laser session.
I use the Hemolumin. I have the Hemolumin.
Now tell us about Hemolumin, because Dr. Parita mentioned that to me in a phone call about 6 months ago.
I don't know what it is.
Yeah, so tell me about Hemolumin.
Yeah, what is that?
So we use it. You can use it by itself, but I usually use it when we're doing ozone, since we're going to have the blood passing out and back in anyway. And it comes with a triple cuvette. It has 3 crystal tubes about this long, and the blood will pass back and forth on the way in and the way out. It's red laser, blue laser, amber, I believe, light, and also UV light on each pass.
Oh, interesting.
Yeah, it's a neat device.
So you're actually doing, while with the ozonation, you're also providing photodynamic activity to the blood as it's going in and out?
Exactly. Because you could do the Hemolumin by itself. Somebody could literally come in and you literally draw their blood out and let it pass over the Hemolumin, and then you put it back in. But if we're doing ozone anyway,
Parita's doing this too?
Yeah. And he said that this is Dr. Parita. I'd love to hear your opinion on this as well. But he basically said to me, Josh, this really is next level stuff from some things that we've been doing.
Interesting. I'm unaware. I need to learn more about this. I wonder if Dr. Frank has this too. No, he doesn't.
But
so how long have you been doing the Hemolumin?
Oh, probably 3 months. Not long at all.
Okay.
But I was, I don't know. There's an email that I'm on with Dr. Thompson and some other people, and it came up, and I started doing my research and asking questions, and I was like, oh yeah, I need that.
So please help us understand, what kind of differential benefits have you seen with the Hemolumin?
Well, for one thing, just like with the red light portion, so the UV portion, it's antimicrobial and things of that nature.
Sure.
And I use it because it's in there, and I'm fine with taking care of any microbes that may be circulating. However, the red light I really like because the red light not only dumps energy. So I don't remember the exact time, but it literally lasts for hours upon hours upon hours. It's not like it passes right, into the blood and then that's done. It actually stores that energy, which makes sense. But also,
nice.
in doing my methylene blue research, I came to realize that nitric oxide, because everybody thinks wonderful things about nitric oxide, and there's super beets and all these things that you can take for nitric oxide, but it turns out,
Sure.
well, it doesn't turn out, physiologically, CO2 is actually your best vasodilator. If you get to the point where you need nitric oxide, well, that's a backup system. And nitric oxide.
Oh, interesting.
Because nitric
So
oxide,
CO2 is essentially the waste product, and so the more CO2 you have in your blood, the more your vessels will dilate in order to help facilitate its release.
they will dilate. They will dilate, and that's your basic vasodilator. If you get to the nitric oxide portion, well, that's the backup system. But
interesting.
Another potential problem with nitric oxide is in the electron transport chain, your cytochrome C oxidase, where your oxygen binds in order for the last step of making ATP. Nitric oxide knocks that out of the way. So it doesn't help you as far as efficiency goes in your mitochondria. Methylene blue, however, takes care of that. And then the methylene blue with red light does an even better job because red light will knock it off too.
Interesting.
So I'm curious, but because of sunlight's vast effects, even measured on the hormonal system of the body, is there any hormonal effect taking place when you're doing hemolumin and treating the blood with these different wavelengths of light?
I don't know that answer, but I would be surprised. And now that you mentioned sunlight too, you're right. I can't say enough about sunlight, and it breaks my heart. Every morning I'm in seeing patients at 7:30, and I wish I could find a secret passageway up to the roof where I could go hide out for 15 minutes with my shirt off every morning about 10 a.m. because that is some of the best medicine, along with good clean food. Sunlight is good for you and proper exposure.
All right. So we've got a couple of minutes left here, and I feel like we're just getting started, Adam.
I'm so fascinated. So we've been learning about ozone therapy and hemolumin, right? And
passing
CO2.
Passing wavelengths of light through blood that is actually outside the body and then putting it back in. Is that not
That's
really
cool.
interesting?
That's cool. Right? What's really interesting is that it has a dynamic effect on people. It helps them regenerate and restore normal function in the body. You're saying the red wavelengths of light actually store in the blood and have effect long after you've irradiated the blood.
Yeah. So I have to mention, Adam, we have people like Dr. Spence on the program because 10 minutes of this podcast, Ultra Life Today, and people are already going, this doesn't match up with any experience I have when I go to the doctor.
Right.
Talking about doing not only these large labs for them, but then doing things like reverse T3 for thyroid that fall outside what would be normally recommended by a physician. Then you start talking about these unique modalities that Dr. Spence employs at Regenerative Medicine Associates, which we've really only scratched the surface. We're going to actually have to have him back because there's quite a few more toys he has in his toy box.
I'm itching to try them. I mean, just like when we talked to Robert Odell and he talked about his nerve paradigms and the ways that he can regenerate nerves. Yep. Man, we're talking about a long COVID potential regeneration restore. I need it. I'm still hitting a wall every now and then. So there's stuff going on residual in my body. Boy, maybe I'll fly to Georgia.
So you have been listening to me, Josh Bellew.
And Adam Payne here.
And Dr. John Spence in Vidalia, Georgia. And we've just begun to scratch the surface. We're 3 segments in, Adam. And I want to come back and let Dr. Spence kind of wrap it up with kind of the maybe a little bit of the patient experience, but on our break, he mentioned something about peptide therapy. Both you and I were wiping the drool off the edge of our mouth because we want to hear more about that.
Yeah, we talked about this just with Dr. Deanna Wyndham, and she's been doing a lot of peptide therapy. I wish we had more of it here in Oklahoma.
Yeah, so we're going to a quick break here. Again, you can get a hold of Dr. Spence at regenmed.io. That's REGEN med.io. or 912-537-0221. We'll be right back with our final segment with Dr. John Spence. Hey, thanks for staying with us here at Ultra Life Today. I'm one of your hosts, Josh Bellew, and I'm here with
Adam Payne, and we've been talking to Dr. John Spence about so many different things.
Yeah.
He said a magic word, actually, during one of our breaks.
He did.
And it really tickled my fancy because I am so enamored with this topic. And you know it. I've been talking about this stuff for a long time. There's actually been one of the kind of these therapies that I've been using myself off-label for many years to help my nerve issues, and it's called Cerebralesin. It's which is an Austrian technology of the ilk of peptide therapy. Doc, you talked about peptide therapy. So illuminate our audience. What is peptide therapy, and why should everybody just be all over this stuff?
So peptide therapy is literally that. Proteins are essentially polypeptides, and a peptide is just a sequence of amino acids, usually shorter than a protein. And this research has been going on for many years, most of it not in this country, but they find a molecule in your body that's bioactive, whether it's growth hormone, any number of them, and they actually find a portion of that protein that is the most bioactive. So instead of having to give somebody an entire protein, they literally came up with a small chain of amino acids called a peptide, and there are various ones depending on what you're targeting, and you can just inject that into your skin. In the case of Cerebralesin, you probably use a nasal spray.
Actually, I injected IM. Yep, it goes right into my muscle.
They make it for nasals as well. It'll go straight through your cribriform plate. Yeah,
I like that idea.
That's easier.
Yeah,
it's a lot easier. So essentially, the protein is a folded peptide with all sorts of different functions. Proteins have all sorts of pleiotropic functions in our body. The peptide goes down to one domain where it has an activity. In the case of Cerebralesin, it's actually neurotrophic factors, which is a fancy word for nerve growth factors, for helping to regenerate and restore different parts of the nerve in the body.
So, Dr. Spence, pretend for a moment I'm one of your patients and I come in. You've discovered something and you recommend peptide therapy to me. What would be some of the things you might discover that you would say, I believe peptide therapy is going to have a significant benefit for you, my patient?
Sometimes one of the lab tests we do is an IGF-1, which is an insulin growth factor 1. We test that. We use it as a surrogate marker for growth hormone levels, because growth hormone is a pulsatile hormone, so it's not realistically measured outside of a laboratory setting, because it's pulsatile. But if the IGF-1 was particularly low, we might put you on a growth hormone analog peptide that you would use, 5 nights a week or something like that. Just take a small insulin needle to take injection.
So then that would have the effect of helping to boost the body's ability to regenerate and to restore function?
Indeed, because growth hormone will certainly help you, even not just after injury, just your normal wear and tear of life. Growth hormone helps maintain your tissues.
So I know the FDA doesn't like peptide therapy at all, and it's very there are only a few pharmacies or centers around the country that will provide to doctors these different peptides. Could you tell us a little bit about the menu of options that you have as a doctor in prescribing peptides to different conditions?
And pardon my ignorance, peptides, guys, are these synthesized? Are these considered to be natural? Is that why they fall outside the domain of the FDA, or do they?
I don't know. That's a great question.
I feel sure that they are synthesized.
Okay. Okay.
But as far as the FDA, I don't know if it's a coincidence or not, but it seems to me that they do get irritated with a lot of things that aren't patentable. We'll let everybody else do the math on that, but
Sure.
I don't understand. But now it could be because things that aren't patentable can't nobody can do the research required to get through the hurdles for the FDA
Sure.
because there's no incentive to do that
a
research.
Right,
So it's
because
kind
they
of
haven't tested the safety
Yeah,
and the
so it's-
efficacy, and
Yeah.
so it's not proven. It's not proven research.
Not here. There's certainly studies that have been done and is used regularly in lots of places in Europe, especially.
Yeah, Europe has a lot of them. So how many different peptide therapy modalities are there?
There are a lot, and I've usually
Really?
yeah, there are a lot. Anything from like I said, growth hormone issues. If people are having a hard time getting their testosterone level up, you can use something called kisspeptin. An interesting case. I had a patient who was, I think it was early 30s. He had a low testosterone, and he felt so bad with low testosterone that he didn't want to come off of it. But he and his wife wanted to have another child. And usually, if you're on testosterone replacement, it suppresses your sperm count and things like that because your body's recognizing that you already have enough testosterone. So it doesn't try to.
Oh, interesting.
So actually, I gave him kisspeptin for about 2 months. And while he was on testosterone therapy, he actually conceived. It was
that's great.
interesting.
Yay.
So, well, the
Babies.
point is, you can stimulate the testicular tissue to. I mean, it works well.
So rather than providing exogenous outside of the body testosterone, you actually used a peptide to stimulate his body to produce more testosterone naturally.
That's right.
Is that right?
And increase his sperm
wow.
count. Yeah.
Right, because that's
And so do you see, we're well familiar when you get a safety data sheet out of the inside of a medication and it's as long as your arm and it's so small you can't read it. And a huge portion of that is dedicated to not only contraindications, but the potential of adverse events.
Right.
You're using peptides a lot in your practice, obviously. Are there concerns about adverse events with peptides, or is that somewhat minimized as compared to a pharmaceutical drug?
So it's minimized, and the concern would be, as with adding any peptide into someone, you would certainly want them to do it in your presence for the first time to make sure this just wasn't an allergy that they might have to this. So you
No
can address
anaphylaxis.
that.
Okay.
But outside of that, they're very easy to.
these are natural parts of the human of the human biome. Essentially, it's not a drug. It's essentially a fragment of a protein that's naturally part of the normal human biology.
So do people actually harvest their own to do peptides?
I don't know.
Does that ever happen?
That would probably be cost prohibitive.
Yeah, no doubt. No doubt. Of course, they figured it out with stem cells.
They
but
did.
anyway.
They did. Interesting.
So go ahead. I'm sorry.
No, go ahead. I was just going to segue.
The stem
into
cell
something.
thing came up, and we were talking about in my early days. I went and trained. That's probably 8 years ago or so, down in Miami to harvest the autologous stem cells. And
Right.
Over the years, everybody has kind of been on the side of, well, if you're getting stem cells from another source other than your own body, well, then they're not as good as yours. And I believe that for years, and I'm not saying I have a stance one way or the other right now, but I'm starting to lean the other way with the technology we have now for collecting biologic tissues from placental tissue and from donated umbilical cords as well.
Yeah.
Because those aren't old cells; those are brand new cells.
Right.
There's some groups. There's a storm of brewing in Oklahoma. There's some groups that are.
It's a group out of Texas.
That is
Infinity Stem Cells.
Infinity
is the name
Stem
of
Cell.
What they're calling them.
Yep, and they are harvesting cord blood from mothers that donate it.
And it's a very strict program that they have for even accepting any of the cord blood.
Oh.
So they actually turn down over 95% of their applicants.
Interesting.
Yeah. So it is fascinating stuff, Dr. Spence, too, because I've had some individuals I personally know that did the infinity stem cell thing, and they have had what I would consider spontaneous remission of a couple of things that you cannot explain away other than that very thing. It's been quite unusual. And we just want to take a deeper dive and learn more.
Agreed. And I do it every day.
Wow.
There's so much to learn in this field. It's fun. It's actually turned out to be what I always thought being a doctor would be, where you're actually doing something that you can continue learning something brand new every day, and as opposed to reading the latest drug brochure.
Yeah, that sounds like the kind of adventure I want to sign up for. My mom passed away about 13 years ago, but she was a very wise woman. And one of the things that she would always say to me, there was a period of time where I took care of her for a lengthy period of time as she got slower to passing away, but her mind was like a steel trap. And she would always say to me, I'd like you to sit down and tell me what you learned today. And every day she wanted me to make sure that I was taking time to smell the roses and looking around and not just getting stuck in a groove and hamster wheel and doing that. She wanted me to be branching out and learning stuff. So I want to sign up for the kind of thing that you're doing there, where every day new technologies are being presented to you and you get to sort through them, and then you get to introduce these incredible things to your patients to allow them to have a different level of health.
Regenerate, restore, recover. Those are beautiful paradigms.
So with about 3.5 minutes left, can you do a couple of patients? Obviously, privacy would enter into this. You wouldn't mention names, but would a couple of patients come to mind where you just said, they came and this was what was going on? You mentioned one of those with that dentist early on, but he actually treated himself. Can you think of some things that have happened in your clinic where you just go, that was this person, and now this is this person going through our process?
First of all, your mother was brilliant, based on that story. On an orthopedic standpoint, I did have a guy who came in who had had 3 surgeries on his knee, and it was a mess. It was almost hard on the outside. Young guy. He may be 50, but he's couldn't do anything. So he came in, and I just did PRP and with ozone, obviously. And then every time we do an injection, we do pulsed electromagnetic field therapy afterwards.
Interesting. What's that?
Yes, PEMF. Oh, I can't wait for you to go down this. Go ahead.
Essentially,
post electromagnetic field.
That's right.
Okay.
So essentially, when you have chronically injured tissue, you have a lot of this tissue becomes senescent. The cells become senescent. So as for the people out in the audience, it's kind of like a hibernating bear. All the parts are there. It could work, but they don't work. Right. PEMF helps regenerate the membrane potential across cells, essentially wake them up. And
interesting.
So it jumpstarts that senescent cell?
It jumpstarts that.
Wow.
And,
really?
And another very interesting thing about them as well, you can look at blood cells, almost like pulling socks out of a dryer in the wintertime, how the socks will stick together. A lot of our blood will do that as it's passing through. It's not clotting. It's just kind of sticky and hanging on to each other. After
which is not good, right?
It's not as efficient because if you think about a red blood cell, its whole idea is surface area.
Right. It's supposed to interact with tissues and go other places. Yeah.
And if you treat somebody with PEMF, their blood cells start to repel each other, which not only helps with surface area, but it helps push the blood, helps circulate the blood, helps push it down the capillaries because they're repelling each other.
Interesting.
It's neat therapy.
Interesting.
But anyway, sorry, this gentleman, one shot. He called me 6 weeks later, and he said, I need to come get another shot. And I was like, so how are you feeling? He goes, my knee feels great. It's never felt better. He goes, but I'm going, I won't say never felt better, since he's initially injured it before the first surgery. And he said,
I can't remember the last time it felt this good.
But he said, no, I'm going to the Bahamas, and I'm going to be walking a lot, and I don't want to screw this up. So I just want to come get another one. So we did. But I mean, that's been, I don't know. Probably been 9 months ago, and the only time I hear from him is when he's sending me new patients.
That's awesome. Very nice. Yeah. So this is Ultra Life today. We've been sitting here having a awesome dialogue.
We've covered so many different things,
and he's still got a list on his website. You have to go to this guy's website.
We've got ozone therapy. We've had peptide therapy. We've had PRP. Well, we have had the pulsed electromagnetic therapy.
Just touched on hyperbaric for a moment.
Yeah, hyperbaric was for wound care. Okay, so really that's the ozone pathway. We had photodynamic therapy with the Hemolumin.
Yes.
Oh my gosh!
I know,
and there's more.
So there's a way to get a hold of Dr. John Spence. It's regenmed.io. That's REGENMED.io. med.io. Phone number to reach Regenerative Medicine Associates is 912-537-0221. Well, Adam Payne, this has just been a blast once again. Feel like the time just went by like that.
It did, and I've learned so much, and I'm just hankering for more.
Yeah, right.
I'm ready for my blood to get ozonated.
Hey, Dr. Spence, you think it's possible sometime, a couple months down the road, we'll get you back on?
Oh, sure. Yeah, just give me a call and we'll work it out.
Thank you so much for joining us. This is Ultra Life Today. I'm Josh Bellew.
I'm Adam Payne. Thanks for joining us, and stay tuned for our live portion.